Heartbreak. We've all experienced it in one way or another. That unexpected breakup from your partner, losing a pet, love, loss, life. How do you mend a broken heart? Or even better, how do you keep it from getting broken or unhealthy in the first place? Conversations about heart health have always been around. We've heard that putting off weight and being skinny is ideal. As long as you exercise and aren't feeling any heart pain, your risk of a heart attack happening is close to none. Actually, all of these aren't necessarily true. In fact, the emotional heartbreak we mentioned earlier, even that can cause actual physical cardiovascular issues. Let's talk about cardiovascular health and how to avoid a broken heart. Literally. The heart is the central pump of the body. It supplies blood and nutrients from the top of our heads right down to the tips of our toes. When the heart weakens, the supply of blood in our body is affected. So, what will it feel like when your heart starts to decline? When people think of heart disease, the most common symptom that could come to mind is chest pain. But actually, there are more signs that we should be on the lookout for, and they might not be what you expect. We talked to Mr. Emmanuel Reyes, a post-op patient currently enrolled in Asian Hospital's cardiac rehab program, and his wife, Mrs. Ligaya Reyes, to learn more about their experience.
Nighttime, he was uneasy going sleeping. He wakes up every now and then to go pee. Then finally, I asked him, what's wrong? He does not feel well that night. So the following morning, he feels dizzy. Nahihilo daw siya. Suddenly, nag-slump siya sa bed backwards. Nag-spit out siya ng blood. Blood was flowing out from his mouth. He went to the bathroom. Pagdating niya sa bathroom, nag-poop siya, which was black stool. Hindi na siya okay. So we had to rush him sa hospital.
To learn more about the symptoms and misconceptions around heart health, we talked to Dr. Eduardo Yambao, a cardiologist from Asian Hospital and Medical Center, and Dr. Bong Javier, head of the section of cardiology at Makati Medical Center.
Usual symptoms of heart disease include chest pain, shortness of breath, palpitations, dizziness, loss of consciousness. All of these, singly or collectively, manifestation yan of heart disease.
Yung most common talaga, especially if mild form of disease, is no symptoms at all. At the early part of the cardiovascular disease, usually walang nararamdaman yung patients. Then, usually, symptoms do come in pag may complications na. Anong mga symptoms na to? This would include chest pain, kung nag-heart attack na, or difficulty of breathing. So magkaka-problems din sa mga ugat sa eyes. So there could be blurring of vision, increase in blood pressure, so there would be pain sa back of the neck. And also, there could be problems with walking, especially mga veins sa legs pag masakit. And there are also uncommon symptoms. Ito yung minsan abdominal pain lang, yung pala heart problem na. Or pwede din na merong pain sa jaw area na it could be a manifestation of heart problem.
Experiencing these symptoms, or lack thereof, doesn't automatically mean you have heart issues. But it's still best to talk to your doctor to rule out any possibility. Because while you think it can't affect you, heart issues could actually happen to anyone.
In his younger days, he's a smoker and he's a drinker.
Siguro yung
Lifestyle.
yung ginagawa kong puyat nung araw, saka yung
Kino-compensate niya ngayon.
compensate ngayon.
He had a happy life. Na-enjoy niya ang buhay niya before he was diagnosed with heart ailment. I would attribute it more baka yung lifestyle niya siguro. Pwede rin siguro sa genes, di ba? He's diabetic and he has hypertension.
You might think that cardiovascular health has to do heavily with your genes. Or maybe you think it has to do with your lifestyle. In reality, it's a mix of both.
The risk factors is really a combination of genetics as well as lifestyle. A strong family history can really pose a big risk sa isang person in having cardiovascular disease later on. But lifestyle factor do have a big role also, like diet, physical activity or lack of physical activity can also make a person at risk of having heart disease.
Smoking, cholesterol level, the presence of diabetes, hypertension, sedentary lifestyle, overweight, and obesity. So if we control any one of these, there will be an impact on the causation of heart disease. Sedentary lifestyle, for example, I think we can recognize that this has been our lifestyle in the last 3 years because of the pandemic. Regular brisk walking, jogging, running, biking.
Common risk factors of cardiovascular issues include vices, not getting enough exercise, having pre-existing conditions like diabetes, and the like. If you noticed, most of these have to do with your physical health. But have you considered the fact that mental health also plays a significant role in your heart's well-being?
Mental health do play a big role sa cardiovascular health. Kasi pag stress tayo, yung body natin nasa flight and flight response. So may mga chemicals, mediators, substances released that could increase the blood pressure, increase the heart rate. That's why proper stress management should be practiced by everyone. There's this term na yung broken heart syndrome, or what we call also in medical parlance na Takotsubo cardiomyopathy.
Ito po a condition that results from an acute effect of stress on the heart. The heart begins to dilate, and then it can lead to heart failure. It doesn't happen very often, but when it happens, it can be catastrophic in a few cases. So that kind of condition can be a manifestation of what can mimic a heart attack.
So, how do you deal with a broken heart? The doctor's advice is immediately. It's best to get checked up regularly to spot any potential issues instead of going to the doctor with an already worsened condition or resorting to DIY remedies at home.
We should also keep in mind, you may not feel anything and yet have heart disease. There's very little in medicine which is absolute, meaning if you don't feel anything that everything's fine. That's never true. Only a doctor's visit will really help us find out.
Proper cardiovascular treatment and maintenance is accessible, like in hospitals from Metro Pacific Health, the largest private group of hospitals in the Philippines.
In Asian Hospital Medical Center, we have the Asian Cardiovascular Institute, and this caters to the cardiovascular or heart needs of our patients. And also at Makati Medical Center, at Cardinal Santos Medical Center, as well as the other hospitals under the Metro Pacific Health Group. Patients with other health conditions like diabetes or even high blood pressure need a close follow-up with their doctors, because this could lead to complications and it could lead to heart problems later on, like heart attack or even stroke.
Heart issues can affect anyone, but anyone can also properly deal with them and heal from them. With proper care from your trusted doctors and a few positive lifestyle changes like getting enough sleep, quitting smoking, and getting your daily dose of movement.
Hindi na siya masyado nagagalit ngayon. Unlike before. Kasi we would always remind the ops, bawal magalit, chill lang, relax lang. Kasi nga siguro because of yung kanyang Alzheimer's. Pero most of the time ngayon parang cool na lang siya, chill na lang siya ngayon, chill. Lahat naman ng bagay na pag-uusapan, sabi ko, in a way, in a nice way, you don't need to get angry, you don't need to kailangan sa ligaw ng mga tao. Relax lang, chill lang. Kung may nararamdaman, magpatingin, di ba?
Patingin.
Huwag matakot.
Sabihin sa mga anak, sa asawa na, kasi kung itatago mo sa sarili mo yun, na walang mangyayari sa'yo. Lalala yun. Nagagamot agad ng mga gayon. Basta lakasan ng loob. Kaya natin yan, kaya natin yan.